record it. Wait.
Yeah.
Yeah, it's recording, I think. So previously we finished the other one, the simple one, the basic thing. Now we'll go to the special cases. So what are the sentences? I think someone else is also. I don't see. Good evening, Mr. Ahmed, Dr. Ahmed.
Good evening. Yes, I'm
Yes,
Dr. Ahmed.
yes, Dr. Ahmed. We are starting because last time we just had. I'm Dr. Rana, or you can just call me Rana. We're just starting with the basic thing, what we did previously. So this just to recap, a simple recap is that we have to say something like how we introduce ourselves, how to like when we introduce ourselves, you have to say like greet first, good afternoon, good morning, or good evening. So whatever, and introduce yourself. Then you ask the patient how's the patient, or like what can you do for the patient. Then we go to like how we can help them, or so how can I help yours, like that. And then we start asking more about their cases. So Dr. Nam and we had already done that practice, and we are continuing to the special cases, like what if in case of breaking bad news, or the special cases, what are the sentences we have to use. Okay. So
Okay.
you can listen to us, but before that, I'll just explain why the breaking bad news. What are the sentence we have to use? For example, when we are telling the patient about the bad news, we have to be very sensitive. We cannot say, "Oh, I'm sorry, you have a cancer." You can't say that. So we have to go around, and we have to see how the patient is. Like, can the patient take it at once? Or does he need more time, or does he need someone by his side to before we break the news to the person? For example, how we say it. Here it's given example in the Breaking Bad News. Example A. Here is it. So June, we have the test results back, and I'm sorry to tell you that the cause of your symptoms could be more serious than you think, and that is a risk, and so on. So, or another one is, so we can't say, oh, you have cancer. Or we can say is like, I realize that this comes as a shock to you, but I'm afraid I have to tell you that you may have something serious, what we call cancer. Or another one is C, example C. It is very important that we do like few more investigation, because we are not sure what is it, but I'm afraid that you may have what we call cancer. Another is, fortunately, we caught it early and there may be some treatment, because we're trying to give hope to the patient. So another one is, we will keep a close eye on you and sure you are in very good hands. So you have to keep assuring the patient. And in the example F, it is, it may be a good idea to talk to someone about this. Do you have any relative or close friend with you so you can help you and provide support? So these are the very basic thing. It's a, what you call, basic thing you should know. For example, different scenario for example A. Dr. Nam, are you there?
Yeah, I am.
So let's do with this. You have to use this sentence, the A sample, the example A, breaking bad news. Okay. So we'll start from the beginning like last time. So you have to break me the bad. You will do everything, and I'm here to see the results. So you have to tell me the example A, and Dr. Ahmed, you will be doing example B. So you have to use that word. So you have to use that sentence. But just listen to Dr. Niam
Okay.
and me, Dr. Niam and me, how we will do it. And you can use like, we're just practicing how you can do it. It's just a sample. Okay, Dr. Niam,
Yeah.
so I'm here to for the to get the report. So let's start.
Okay. Good afternoon. I'm Dr. Niam. I'm the attending doctor today. May I have your name, please?
uh Good afternoon, Dr. Niam. I'm Asha Rana.
Okay. And how may I address you?
You can call me Asha.
Okay, thank you. May I check your hospital number, please?
Here is it.
Okay, thank you. And well, Asha, how can I help you today?
Yes, Dr. Nam. I believe that I had some tests done last week, and I'm here for that result. You told me to come this week, so I'm here for the result.
Okay, yes. Well, I have the test results back, and I'm sorry to tell you that the results are some more serious than you think before. Are
So,
you? Mhm. Yeah.
so you mean that? So you mean that it's very, very serious, doctor?
Yeah, I am sorry to tell you that. It's understandable you are in shock state maybe. Are you somebody or someone that you can take the result by yourself, or you prefer to be with someone else in your family?
Yes, Dr. Nam, you can tell me whatever is it. Yes, I can handle myself.
Okay, since the result here that you did some investigation, as I think it is a bronchoscopic examination for the result of some symptoms, you have cough and something like that, and the result that is just suspicious of you have something known as CA lung. Did you ever heard about this CA?
No, doctor. Oh, so what should I do now? What will happen to me now?
Well, it's understandable that you are in shock now. Just we need to be sure that of this. We need to do further investigation, just like CT scan. Are you uh, okay to do this investigation?
I'm scared, doctor. What is CT scan? Will it hurt me? Will it inject me or something? I don't want to do. I'm scared, doc.
No, no, don't be worried. It is something simple. It is and just like radiation and X-ray radiation, but more advanced. It is just like 150 times of X-ray normal, and we will you will enter. It is an equipment that you will enter through, and will do this examination, radiation, and it will not hurt you. It is not painful, and you will finish it within a short time.
Thank you very much, doctor.
So, and after this, I know that you are worried, and I don't want you to be like this because you are in a good hand. We will deal with this. We will see the result of CT further investigation, and it will confirm our diagnosis, and then we will see what we can do further because as further as I told you, it is CA lung, and I don't know whether you have heard about this disease.
Okay. Thank you very much, Dr. Nam. I think you are very you have practiced a lot because you can like say it, follow it very well. That's very
Yeah,
good, doc. So
thank
because
you.
I just want Dr. Ahmed, I just want like you have to be so good at it that when if I give you, for example, I just give you sample, then you should know what will come next. For example, I'm saying like I came for a test. So if I come for a test, what will happen? The patient will be of course if the result is like will be supposed to be not so good. So your mind should be ready. So it should be like, okay, it's gonna be bad news. So I should be, what are the things I next will be? Will the patient be shocked? I have to comfort the patient. I have to make sure the patient is understands what's the problem with his body. So what can I do for him? What can I explain to him? These are the things you should have at the back of your mind. Did you understand, Dr. M?
Okay.
So these are very sample. These are the special cases written here. It's better you memorize or know it at the back of your mind. That, for example, if I say, "Oh, I'm a smoker, doctor," then you have to suggest me, "Oh, do you know that you can quit smoking? And we have a group where you can help this to quit your smoking habit." So if you go to number 4 here, it's written "quit smoking." So you should know what if someone is talking about smoking, you should know that you should suggest a class where you can help the person to quit smoking. And if the person is talking about alcohol addiction, then and it's very serious, you have to know that you have to recommend that you have to go join the Alcoholic Anonymous, which means that you're helping the patient to get rid of his addiction. And another one is the insulin. When the patient has diabetes or he has to take insulin injection, then you have to explain that there is a clinic. We run weekly training programs and it's run by our nurses. And when we're talking to the patient, we have to be very soft, because I know your Arabic and your English accent. When we talk from the Arabic to English accent, it may sound very rough, not rude, but very rough, because I've noticed like the British have very very, I don't know, when we talk, they have very soft. So we have to a little bit like, "Oh, I did not know that. Oh, okay, how can I help you?" Or would that be okay with you? Like we cannot say, "Okay, you go to the nurse," or we cannot say like that. So we have to be very soft and very, like, the patient should feel that you're taking care of the patient very well. And another one is dietitian, is when the person is fat or when obese, or he has some a problem that needs referral from dietitian. And physiotherapy is a person who doesn't have like good mobility, so we have to refer him to physiotherapist. So these are the things you have to have at the back of your mind. You have to refer, the moment you hear alcohol addiction, you should know, oh, you have to refer to him to a Alcoholic Anonymous. If there is a smoker, then you have to talk, you can quit smoking, because that's the job of a doctor. So these are the basic things. Okay.
Okay.
And if you don't understand anything, and if I'm very fast, please let me know. You're welcome to just let me understand. So we'll practice sample role today. There are almost like lots of thing. We'll start with Dr. Nam. We'll just do first Dr. Nam, and then we'll move on to Dr. Ahmed. Is that all right?
Okay.
Yes, okay.
So Dr. Ahmed, yes.
Can you please maximize the picture, because it is just
Oh.
literally, yeah.
Okay. Can you?
I have to scroll down. If so, yeah. Now, no.
A little bit.
Yes.
You can make by
now.
yourself on your screen.
My screen, I couldn't. My screen is
Oh.
maximize or reduce, but it is, I couldn't. I don't know.
How about this one? This one is okay?
Yeah, very fine.
So we have this role play. We have to we have to make sure that we tick on all the things that's written in the task, because when you're given a task, that means you have to finish that. You have to complete that. So the first role play card is for me, and the candidate card is for Dr. Nam. So uh, we'll start. We'll will you put the timer there, or
Yeah, okay. Timer for 3 minutes.
Yeah,
or
5. Oh wait.
5 minutes if we start to talk, but they have 3 minutes to read it, or am I right?
Yeah.
Yes.
So
I will read it now, just to tick it, and then we will make the timer. Fine?
Yeah. Just let
Okay.
me know when.
I will put time for you.
Timer. Oh yeah, that will be great, Doctor.
Thank you.
Thank
That's
you.
it. Fine.
Thank you.
Okay.
Okay.
3, 2, 1, start.
Okay. Okay.
Okay.
Mhm.
Okay, we can start.
Yeah, okay.
Timer.
No, less than 1 minute.
No, we can start now because you can
Okay.
time 5
Okay.
minutes.
Okay.
I will start,
Start.
okay?
Yes.
Good afternoon. I'm Dr. Niam. I'm the attending physician today. May I have your name, please?
Yes. Good afternoon, Doctor Nam. I am Asha Rana.
Okay, hello. And how may I address you?
You can call me Asha.
Okay, and then can I check the number of your number?
No need.
Yeah, this is no need because it's okay.
So,
Fine. Yeah.
so this is sorry. This is also a tricky question. That means whether you are paying attention to the question or not. That's very
Okay.
important.
Fine. Okay.
Okay.
And okay. Well, Rana, how can I help you today?
Well, Dr. Nam, you see, my father, he's 68 years old, and yesterday, like my father has a history of having this, like his heart rhythm is not normal. He has abnormal heart rhythm,
Mm-hmm.
and he's been taking warfarin for
Mm-hmm.
this thrombosis and all these what they call embolism. So
Okay.
and yesterday he was like he was in some problems and pain, so my sister gave
Mm-hmm.
uh, gave him his her own medicine, that is Panadin 40 tablets. So it helped him because he was having so much pain yesterday, doctor. So I today I need to collect his medicine, my father's medicine. So and he cannot walk because he is so much in pain. So can you refill his prescription, please?
Mm. I'm so sorry to hear this about your father. But I think this is not allowed for me. Sorry, I cannot do that. Sorry.
But doctor, he's in pain because he fell down 2 days ago at home, and he has so much, like his leg. I can see so much bruise, and he's like screaming. His right, like his legs is in pain. So what can I do? Like, he doesn't have medicine. Please, doctor, you have to understand and give his medicine.
I understand. Sorry for this, but for his best interest, at my heart, I cannot prescribe it since Benadine is containing some aspirin, and this will not be beneficial for him.
So
Uh, yeah,
are you
sorry.
saying that? So are you telling that you should let my father be in pain? What is this, doctor? I need, I
Um,
need, I demand his medicine. Please give it to me.
No, I'm so sorry. I'm not saying that I'm not going to help him, but I'm saying this is not beneficial for him because Panadine is contraindicated when he's using already warfarin. This will hurt him. So I have to be strict in this. We have some. We cannot. We have some rules. We have to strict with this and protocols. And I'm so sorry, I cannot.
I don't understand your rule and protocol. What do you mean by that? You can just write a prescription. So what does your protocol says? That you cannot give medicine to a patient who's in pain? What is
No,
this, doctor? Then
no, I'm not saying this. I have to examine him first. You have to bring him, or I can do some home visit. We can visit him and we can examine him, and then I can prescribe a drug for him. But not like this. I cannot prescribe anything without examining him. I'm so sorry. I hope you understand this.
but it's waste of time. You just have to write a prescription.
No, it is not waste of time. It is, believe me, it is for the best interest of him, at my heart. And I have to tell you this for his benefit. Please understand.
So
I'm
what
so sorry.
happens? So what happens if you give medicine? So what does it happen? So he'll become better. Like, you just give me pen medicine, I give it to my father, and he'll be okay. So what happens if he does, if you don't see him and give medicine? So what happens?
No, I will give him medicine after home visit, or you can bring him here, and that's all. Sorry, I cannot help you like this. I can help you in another way that's beneficial for
Time
him.
out.
Okay, if you say so.
Okay.
Okay. Yes. So
Thank
we
you for your understanding, and so I can come to your home and I will visit you, and I will prescribe him definitely. Thank you a lot.
okay. Thank you very
Mm,
much, Dr.
Thank
Ahmed. Is that 5 minutes?
Now more than 5 minutes and a
So
half.
5 minutes.
Around.
What we can do is say it in the form around 4 minutes, just like a warning sign,
Okay.
or should we? Because
But
you.
actually, in the exam,
You were very stubborn.
no,
in
because
the exam,
yeah, in the exam I know it's a bit strict, but I just like I want to know like uh how much we can, like, we have to make sure we practice in the time that we know at the back
I
of our
think
mind
the
that
patient was reluctant.
Yeah, that's right. Stubborn and reluctant. That's why
yeah,
I don't know.
I
Is it
have
okay?
to be I
Is
have
it
to be very I have to be very reluctant and almost like fight with the doctor like that. That's the thing. So
okay?
it's your job. I have to listen to Dr. Nam and become okay. But if I don't fight, then I'm not doing my part. So I have to be very like, And what you can do is like because I forgot to tell that in the history previously, and because I didn't tell you, just like so when someone is explaining to you doing the role play, because I didn't explain. Remember, I didn't explain the 2 days ago he fell at home, right?
Yeah,
That
I
was
know.
there.
Yeah,
So
I know,
I
but I did it already.
yeah, but I thought you would ask me what happened. You did not mention why wasn't in pain. So you didn't ask me, so I just said it. But make sure, like, if you are not like clear about, because I said my father is in pain, he needs medicine, and like that I only mentioned that. So
Yeah.
when you're listening to a question, make sure like you cannot ask me the patient number in this, because I'm not the one, the patient. I'm talking on behalf of someone. So these are the things very important when you
So
hear a question.
do you mean in the exam I have to ask him about to ask what happened, or is it okay not to ask?
No, you have to ask, like, just to like converse that if I say is okay, because I didn't say at the first, remember. That's why
Yes.
it's very important to listen to what I say, because
Yeah.
I just say, oh, my father is in pain because he's having this like heart abnormal breathing, blah blah, but
Mhm.
I didn't say did something have happened recently. These are the basic thing. Try to remember, like, if it's not mentioned, just in case, like, uh, uh, make sure that if the examiner tells you, that's good, but you have to be very smart to understand that he hasn't mentioned anything recent
Oh,
history. That's why
oh,
I want you to know that you write it down, that you have to ask recent history also, because there may be some clue there.
okay, fine.
So
That's
so what, here you have to ask the recent clue, and next is because I'm angry and I'm very stubborn and I'm saying, like, no, I want this. You have to say, you see, that's the standard of care. That's very important, the words it's mentioned, because
mhm.
it's given to you. Always use those sentence, like, it's the standard of care, because it's not only for you, it's for all the patient. We don't it's I understand it sounds so unfair to you, but the thing is the standard of care, and it's very important of patient assessment. And when we are making dealing with the decision, or with the patient assessment, then we have to go through this protocol. And as you know, that you already mentioned that your father has abnormal heart rhythm, and he's, like, taking is he taking anything else? Yeah, he's taking medicine, so I can't give you warfarin because it's contraindicated. So you have to explain when you're answering me. Make sure the tax is in you go by it one by one. Like, and don't go outside the thing. Even if I go outside, try to bring it to that, so you show the examiner that you're ticking that, you are doing that, everything.
Okay, I mentioned already that your father taking warfarin and this contraindicated. I mentioned
Yeah,
already.
you mentioned. Yeah, you mentioned. But also try to use those some of the word mentioned there. Try to use it there also, so that they know that you're following the task also.
Yeah. Okay. Standard of care and not for you,
Yeah.
for the
Yes,
patient.
that's
Okay.
and okay, Harry's consent is most durable. And also mention that I know you are maybe you feel angry or agitated right now, but for your father's sake and for your for his sake and for his well-being, this is the thing I like, is most desirable for him to do. And just wait and wait for the reaction. So okay, I think so far that's for it. Now we'll move on to Dr. Emma. Is that okay?
Okay. Benadine contain paracetamol and codeine. No
Yeah,
aspirin.
I know,
But
like,
not
just like saying anything because I don't know. Okay.
but it's okay. They don't it's better if you know everything in detail. Even if you don't know, then that's why they have the clue, like standard of care. You can make up the word and, like, make it sound like very as long as you don't stop in the middle, like just as acting as professional and look at the task.
And it was okay to use that for his best interest. Yeah.
So yeah. So what I suggest, Dr. Niam, is to practice this scenario because one scenario will definitely come from here, where you have to convince the patient. So
Okay.
so you have to practice, like, I understand. So you have to memorize the standard of care. This is the important protocol, or this is important to assess the patient and making a decision in his management decision. And also these are these are basic things. It's like you should know it in your mind without looking.
Okay, fine.
Okay, let's move on to Dr. Dr. Ahmad. Who will Dr. Nam, you will time us?
Yeah, just a minute. First of all, 3 minutes for the
Reading?
3 minutes for the card reading. Okay?
Yes. Yes.
Okay.
Dr. Ahmad, are you ready?
Okay.
Yeah. 1, 2, 3, start.
Okay. Okay. Is that alarm?
No, this is a message.
Okay. Yeah.
Finish?
Ready?
Okay.
You
I
already
think
set the time?
yeah, this
Okay.
is I also want to say this because we are talking in the clinic. You don't need to ask the hospital number in the clinic, right?
Yeah.
Only in the hospital. Just remember that. No,
Also,
Okay.
he said you're a patient. So
yeah, I'm the patient.
I know the patient.
Yeah, it's the yeah. You have to know everything, like what type of question. That's why I'm saying you have to understand this when you to ask. Okay, let's start.
Okay, start.
Good afternoon. I'm Dr. Ahmed Ali, the treating physician for you today. Nice to meet you again. Could you remind me, please, with your name?
Yes, Dr. Ahmed. I am Asharana.
Nice to meet you, Asha. How can I help you today?
Well, Dr. Ahmed, I am not happy with the results I've got. Last time I remember you saying that my recent fasting blood glucose is 7.6, and this is not the first time I've done, and this is my second time. And still, I don't understand why you keep on saying that I've got diabetes. I don't know what is this diabetes is. I think this is some sugar diabetes or whatever. Like, is this the same as sugar diabetes? The diabetes or sugar? Is this what I have?
Okay. Let me explain to you based on the second investigation for you. It may
Mm-hmm.
become as a shock to you uh, that
Yes,
you
it is
have.
shocking.
I'm really sorry to inform you about this, but I want to inform you that you have what's called diabetes. Do you know about diabetes?
No, I don't know. And I don't even eat sugar. For God's sake, why do I have diabetes? I don't understand. I think there's some problem with your machine or something. I mean, how can I have diabetes? I don't eat sugar. I don't eat chocolates. I'm very strict with my diet. And still, I have diabetes. And it's not the first time. What is this sugar thing? I don't know what this diabetes is. Oh, yes, Dr. Ahmed, please explain what is diabetes.
Okay. I will explain to you everything, and I appreciate your concerns. Diabetes is a disease that is caused by lack of a hormone or chemical substance in your body
Mm-hmm.
that make the cells take the glucose and utilize it. Uh, Either you have a shortage of this chemical substance, which is called insulin, or your cells are less sensitive to this insulin, so you need more or higher level of this chemical substance to work probably and use glucose. Uh,
But
am I clear so far?
yes, but how can you be so sure with just two results you're saying already proving that I have diabetes? I mean, are you sure this is the standard thing? Don't you have to do more tests?
Uh, and based on the WHO recommendations, two tests with this result is enough to diagnose diabetes. This is based on clinical research and follow-up of many patients, and this is evidence-based medicine. So we are sure that you have this diabetes. So the next step is to accept this diagnosis, and we will help you to manage this problem. Is
So
it okay with you?
what do I have to do if I'm diagnosed? So what do I have to do?
First, we will give you some medications that will help you. We will start with oral treatment.
Mm-hmm.
Uh, we also will check your blood sugar regularly and your blood cholesterol level uh,
Mm-hmm.
regularly to prevent complications of diabetes.
Mm-hmm.
For your knowledge, you should know that diabetes has many complications, but you can over this complication by following up with us. This complication may be blockage of some vessels of your heart and some problems to your kidney, your eyes. but with follow up and being stuck to our instructions, we will overcome this.
But doctor, I think I need to do more tests. Don't you think I need to do more tests?
No, I don't think. What you need is to follow up with us and stick to our instructions. And also, you should also do lifestyle modification to eat less sugars. We will refer you to dietitian to help you with this.
Well, okay, if you say so, doctor. Thank you very much.
Okay. Be sure that you are in good hands, and don't hesitate to call me, to contact me if you have any further questions.
Okay, thank you very much. I think
Thank you.
that was good. Okay, this was good,
Oh,
but I'm just saying, like, when you're reading the task, both of you, are you like going through, because when I'm doing the, like, saying the task, I'm going by up, like, I'm not looking at you, I'm going by my task, but you have to look at your tasks mostly. For example, if I'm talking about, like, what I was saying, what I have diabetes, how can that be? And so it's yes, and I say, what is this sugar diabetes, I say, right? And you see in the task, the first one, briefly explain diabetes and cause symptoms. You if I don't say anything, just move on to your task. And I say, are you sure? And if I say, are you sure? Yes, because it's recommended and it's determined by World Health, WHO, and it's all the standards, and we have seen all the compared with the standards and evidence from research, and you have to go one by one. So make sure before the bell rings, you complete all the bullets here. Do you understand this? All these five, Dr. Ahmed. So I think that's rather than listening to me. I know I'm also saying, because I'm also completing the uh, 10 minutes to pray. Oh, who is? Okay, I'm sorry. You need a break. 10 minutes break for pray.
No, for me, no.
yeah.
It's not time of a prayer for I don't know if it is on your time. I don't know. You
I
might.
don't.
Yes, because our time here is for praying. You can practice one more card, then we will pray and come back to you.
Okay.
Oh, okay. We'll practice then, Dr. Niam and me. We can practice then.
Okay,
Or should
fine.
we wait? Should we wait for them, because they say somebody request me to wait? So I think it's
Okay, fine. It's whatever you decide. Yeah. For me,
no.
I'm free.
It's better we wait for everyone, so it's no
Okay,
problem for me.
fine. Okay.
10
Okay.
minutes. Okay, we'll just wait 10 minutes.
Pause the recording. Yes.
Yeah, oh yeah. Where is the? Okay, so when we're given a task, make sure you complete all that before you finish. Before you the bell rings. So your
Mhm.
main thing is that make sure you say everything there.
Mhm.
If I forget, if I'm not giving you any clue, you try to ask it yourself. For example, you're supposed to ask me. Uh, okay. Hi, Dr. Rifka.
Yeah, Mustafa.
Okay. Oh, you're Mustafa. Can you? Because I don't know your name. I just see that.
I'll change the
Okay.
account after next time.
Oh, okay. I'll call you Dr. Mustafa, right? So because
Yeah.
I didn't see, so we are doing one more time with Dr. Niam with this one. You can listen to us. After that, you
Yeah.
can do it. You can do it
Okay. Okay.
after Dr. Niam. So I'll call.
Okay. No problem. Okay.
I'll meet you for a while. Okay, just listen. Oh, you can do the timer. Can you keep time for us, please? Okay, okay, Dr. Nem, we'll time it ourselves then.
Okay, fine. I have to make the timer for 3 minutes. Just a minute.
Okay.
3 minutes. Okay, I will start for 3 minutes reading the card.
Okay, make sure you complete all those the tasks. That's very important.
Okay. Hello.
Hello. Oh yeah.
I
Shall
thought
we?
you are. No, just a minute.
If you are ready, I'm okay. I'm ready to start. Dr. Ahmed, we are just practicing one more time with Dr. Nian. So then we will move on to Dr. Mustafa, and then you'll also, after that, you'll be the one. Is that okay, Dr. Ahmed?
I'm finished. Fine.
Okay. Okay, let's start.
Yeah, I will make the timer just a minute.
Okay.
5 minutes. Start. Okay.
Okay.
Okay. Good afternoon. I'm Dr. Niam. I'm the attending physician today. May I have your name, please?
Good afternoon, Dr. Niam. I'm Asha Rana.
Okay. And how may I address you?
You can call me Asha.
Okay. Nice to meet you again. How can I help you today?
Well, Dr. Nam, I have not been able to sleep for a very for some time, because you see, I have my mother-in-law coming to stay with me because she has Alzheimer's disease, right? And I'm trying to look after her. I also work. I have this consultancy business, and I have 3 children, a husband to look after, and I don't know why I can't, I feel so anxious. I can't even sleep at night. So, and it's been going on for quite some time, and I'm really finding it difficult. So can you help me to sleep and give me sleeping pill, please? So I came here to ask you for sleeping pills.
I'm sorry to hear this. I know you are in stressful condition, but I'm so sorry to tell you I cannot prescribe you some sleeping pills. I'm sorry.
Why is that so, doctor? But I really need to sleep. It's been long. I
Well,
need to. Can you?
Well, I understand that. I'm sorry, but this is not good for you because the pills will make you someone who is dependent on it, and we don't want you to go through this way.
I beg your pardon. I cannot be dependent. I work in consultancy business. How can I be? Are you saying that I'll be addicted to sleeping pill? No, no, doctor. You can trust me. Are you insulting me that?
No, I'm sorry. I'm not meaning that, but you have to understand me because these pills, it will cause some dependency. This is well known for doctors and pharmacists, and we have a standard for this prescription of this treatment. So I'm sorry again to tell you I cannot.
So, but I need to cure my anxiety. I can't look after my mother-in-law. I can't look after my business, run my business, look after my children. No, you don't understand. I'm so anxious. I really need to sleep. Please, doctor, you have to give me the sleeping medicine.
It's understandable, but I will tell you something. We can manage this anxiety by other ways rather than going through prescription pills. You can just like have some listening to some music, something that enjoying you, and you can even have some exercise, joining your best friend, or chatting with someone you love to talk to, or you have some self-caring technique, any other thing that some dietary measures. You can eat different things that give a pleasure for you, just like chocolate, although it has its side effect, maybe you gain weight. However, this can help you to combat your anxiety. I think this will help you.
So, but what will I do with my insomnia? So what will I do? if you don't give me medicine, and aside from the technique, do I have to see someone, or what should I do?
Well, I'm telling you, as I mentioned first, we can just go through that what I just mentioned, and we can also make during sleep, make your sleep is more comfortable, just like you sleep in good hygiene sleep with closing the curtain and good environment are surrounding you, no noisy things, and you have you can even listen to music before sleep, make or read some story that you like, any other things you can make to sleep and relax before going to sleep, and this will help you a lot. And other thing, we can also make counseling to some or referral to psychologist that he has stress management. I think
That's it. Yeah, you forgot to go. I made the second point, so you can go to the last point, but I think you stuck with the second line. That's why you have to be very, like, make sure you complete all first.
yeah.
Because that's why I was asking, saying again in the middle, because you forgot to mention the counselor and the psychologist for stress management. That's why I say why, because I want you to go to the last and finish that one. So it's very important the task is finished completely. If you don't
Yeah.
finish the task,
Yeah,
then
but I don't know why I just make some stress thing about the second line. It's okay, fine. Maybe
yeah.
I have to go through so in hurry, so fast. Yeah.
Yeah. So what I want you to do, everyone, to understand is that you have to go through all your tasks completely and make sure you say it nicely. Don't do it again and again, because I'm also going through my tasks, because I have to finish my task. You also have to complete that task, that task for you candidate. So you can't get stuck in one.
Yeah.
Otherwise, you have to make sure in 5 minutes you complete that. And if I don't, for example, maybe you're waiting for me to say, do I have to go to see any doctor? Don't wait. If I don't say it, you jump and finish your task. Well, I can also refer you to a psychologist. And don't I think you are what happened is you are stuck in a lot of the second and the third bullet. So don't,
Yeah. Yeah.
make it smooth,
Yeah.
make it, just go to read it nicely. You don't have to what I'm doing is read it nicely. Like, for example, I can suggest you to join stress management, or focus on anything that's natural, or make a good sleeping environment or habit, like drinking milk before sleeping. Like, go slowly, because otherwise you'll be caught up there. Okay,
Okay, fine. Okay.
one by one, slowly, smoothly. Just imagine you are going one sentence, okay, done. Second, done. You do it slowly. Third sentence, done. And the fourth sentence, done. So make sure you complete all in 5 minutes. That's very important.
Okay,
That's the
fine.
main thing. Okay, we will go with Dr. Mustafa. Is it okay? Dr. Mustafa, are you here with us?
Yeah, I'm with you.
Yeah, okay. We'll move on to the next slide. So
Yeah, I'm ready.
okay, I'll mute Dr. Niam and Dr. Ahmed. No, after.
Ali.
So you can time it, right? You can put a timer.
Yeah, I can put.
So when we are doing, make sure all the tasks, the bullet 1, 2, 3, 4, you have to complete. That's very important before you. That's very important, because I'm focusing in my role play, and you should focus on your tasks also. And it's your job to make it say it nicely. That's the only thing. Okay.
Okay.
So we let's time for 3 minutes to Dr. Ahmed. Can you time for us,
Okay.
please?
Okay. 3, 2, 1, start.
Okay. 3 minutes to read. This is for reading. And notice you are in a general practice.
No, so I'm GB. I will refer to specialist.
I think this one, it's general practice is a clinic or okay. Let's read first. I'll figure out.
Okay. Okay, as I noticed, I'm the treating physician. I will not refer.
Yeah, you're the candidate number two, card number 2 down. You have to read that one. I'm the ones doing the role. I'm the patient.
Yeah, I think I'm ready.
Okay. Okay, let's start.
Okay.
Okay, start. I will fill the time.
Yeah. Good afternoon, Mrs. Asha. I'm the treating doctor for you today. How can I help you?
No, you have to ask my name. You can't jump.
I will ask your name first.
First, you introduce yourself. You greet me, then introduce yourself, and you ask how. May I have your name, please, first?
Okay. I'm Dr. Mustafa. I'm pediatric surgeon. I'm working here in Saudi Arabia at Taif at Al Hada Armed Forces Hospital. Nice to meet you today. Can you clarify what's your name?
Hello, Dr. Mustafa. I'm Asha Rana.
Yeah. Welcome. Nice to meet you.
Mustafa, do the card.
Can you?
You make an introduction.
Okay.
Do the card.
Okay. Can I stop for a little bit? Okay. Let's practice the introduction one more time, Dr. Mustafa. Is it okay? We'll pause for a while. It's okay. Okay. First, whenever we are starting, first you have to greet me. Good afternoon. Okay. Good afternoon. I'm Dr. Mustafa. I'm your attending physician. May I have your name, please? That's your first line. Always remember this one, the first sentence.
No, I think that I will identify myself to you, and you will identify yourself in the 3 minutes before we start the card, not at the card time.
I beg your pardon? I didn't understand.
As I understand, you, I will identify myself to you, and you will identify yourself to me before we start the card.
No.
Breaking ice before the card.
No, that one is different. The one we ask you, how are you? Those things, those are not counted. The score are not counted. The marks are not counted. But we're not practicing that. This one is the real thing.
So even in the card, I will identify myself to you and ask you your name.
Yes. It's very important. That's the number one thing. If you don't, then you have to introduce yourself no matter what. The first thing, okay, I'll explain the first thing. We do the general talk, the examiner, how are you, where you work. These are not counted. These are practicing. But when we come to this one, we are your score is you have to behave like a doctor. Now you have to behave like you're really asking me. So no matter what, it's always important to introduce yourself and ask the name. No matter what. That's the number one thing. I'm so and so doctor. I'm the attending physician. May I have your name? It's very important. You cannot skip that one, no matter what. Because otherwise, I don't know how to call you, and you don't know how to call me. So how will you do the role play? That's more important. Okay. Can we start? Yeah, but you can do it slowly if you don't remember, but that's very important. Let's start.
Okay.
I will see the time. Start.
Good afternoon. I'm Dr. Mustafa. I'm the attending physician today. How can I help you? May I know your name, please?
Yes, I'm Asha Rana, Dr. Mustafa.
Yeah, welcome, Ms. Asha. How can I help you today?
Well, sorry, after that, don't say welcome. It's not nice to welcome. Just say, how may I call you, or how may I address you? Means,
Okay.
if I say Asha Rana, then you have to ask me, how may I address you? You want me to call you Asha, or you want to call me Asha Rana, or you want me to call you Miss Rana? What do you want? So you have to, how may I address you? Always, second step.
Okay.
One more time from the beginning.
Okay.
But is
Good afternoon.
it good to say nice to meet you or welcome? Or
No, I think it just let's stick to professional. It's not, hospital is not a nice place to welcome, you know. So
okay.
just stick to that.
Anyway, welcome, Mrs. Asha. Okay,
Okay.
let's start.
Let's start. Okay.
Okay. Good afternoon. I'm Dr. Mustafa. I'm the attending physician for today. May I have your name, please?
I'm Asha Rana.
Okay. How I address you, Mrs. Asha?
Yeah, you can call me Asha only. It's okay.
Okay. How can I help you today, Mrs. Asha?
Well, you see, Dr. Mustafa, I'm having this problem. You know, I had this a pain in my left ear for like a few days ago, and I was taking some paracetamol. And then I felt that like the pain was very severe last night. And this morning when I woke up, I saw pus on my pillow. And it become, and I think it's because from that painful ear that I had few days ago. So now, but the pain has decreased, but I'm just worried that I can't hear properly. So I don't know what's happening to me. What should I do? I'm just worried, doc.
Oh, Miss Asha, I'm sorry to know that. It must be stressful for you, but I will
Yes.
assure you, this is a condition that's called otitis media. Do you know more about that?
No, doctor. What is it? I'm scared. Can you explain to me, please?
Let me explain to you. Okay, this is a condition that inflammation occurs in the middle ear, where pus collects in the middle ear and the low pressure inside the middle ear, so the pain was severe. Then the drum ruptured and the pus get out, so the pain decreased. This is not uncommon condition, but I will assure you, I will give you medications, I will follow up you, and I will see you after again to see the condition of.
But oh my God, that means I'll be.
If it is yeah.
It's not clear. Oh my God, that means I'll be deaf. I can't hear. The pus, you know, so much pus came from my ears, and isn't it like there is a hole in the eardrum? It becomes very serious. So what will happen to me? Oh my God.
Yeah, I'm so sorry for that, Miss Asha. This is not unusual occurrence of this condition. This is a small perforation, as I see in my exam.
And will I be deaf?
Examinations, small perforation that already will heal. This have no permanent effect on your hearing. It is a condition that is okay, that can occur many times, and I will follow up you and I will give you medication to relieve this condition. Okay, is that okay for you?
Yes. So aside from medicine, what will you do with the pus? Do I have to take out the pus, or do I have to do other treatment?
As I said to you, Mrs. Asha, I will outline the treatment for you. This is a condition that you will take broad spectrum antibiotic to decrease the infection. I will give you some pain meds to relieve the pain, and I will review you at the end of the course to see the condition of your eardrum. To be assessed again after the end of the course. So after the drum is already healed, I will if there is any hearing defect, I will do a radiological assessment for you. Is that clear for you?
Yes, but doctor, I also like to do scuba diving, and you said that there is some like pressure change in my ear, so that means can I do scuba diving? Because that's my favorite thing to do.
Yeah,
Fine.
as you know, Mrs. Asha, this is a special condition. You have perforation in your dam, so we will avoid any pressure changes like scuba diving, like aircraft flight, until the condition is completely resolved. Is that clear for you?
No, doctor, I have already booked my scuba diving. I have to go scuba diving.
This is a temporary condition, Mrs. Asha. I will not ask you to permanently avoid this, just until the perforation healed, and after that you can resume your daily activities as you need, okay?
Okay, if you say so. Thank you, doctor.
Okay, Mrs. Asha, if you have any queries, don't hesitate to contact me. Thank you.
Thank you. Well, I think we are, Dr. Mustafa, your explanation is not so clear in the middle. And also, it's a bit rush because I did not understand what did you explain to me, but I was worried you won't be able to finish everything. So I jumped to complete that task already. So what I suggest you is to slow down and
Okay.
there is this, excuse me, I'll show this, where is that? It's not here, maybe I'll show you later. That has what you call the, where's that?
I know you just disrupted me at the beginning, so I am stopped
Oh yeah.
after that.
Oh, okay. So
Well,
that yeah,
next
just
time we'll
you
avoid.
yeah, you can just memorize that one and just go don't no need to say all that, Miss Asha, don't say that. So you just have to pause and say, yes, I understand what you're saying, but like, be gentle, very very soft. And the problem is that you have some there is a hole in your ears or something, explain. And there, you don't have to worry, like, because I'm very anxious because I have to talk like that because I'm impatient. But you cannot be like fast, you have to be very gentle. And I say, I understand, but don't worry, you don't have permanent defect or hearing effect. I'll give you some medicine and you'll have some tests. Just read, because I think you all are not reading from the task. It's very important you read what's written. Like, for example, you have to say, well, I'll give you so many broad spectrum antibiotic which will help you to heal you. And also at the end of the course, then we can also reassess what happened to the hole in your ears. And then we also have this audiological testing. And if there is if you feel that you cannot hear properly. And I also have to advise you that please don't take any, like, any activities that involve pressure change, like aircraft flight, driving, diving, etc. Is that okay? Like that, you can't be fast, you cannot jump. I can jump because I'm anxious, because I don't want to listen to the doctor, but you have to be calm and listen, and you finish all what you have to say slowly. Did you
Okay.
understand?
Yeah, clear.
Okay.
Thank you.
Thank you. So we'll go to Dr. Anyone has any question, please let me know. If I'm fast or if I'm not clear, it's okay.
It's okay.
Okay, we'll go to Dr. Ahmed. Are you ready?
Yes, ready.
Okay. So, okay, let's start 3 minutes reading.
Yeah, do timing.
Mustafa, you can what's the time?
Yeah, time.
Yeah, you can.
3, 2, 1.
Okay. Yes, I'm recording. Thank you, doctor. It's not so big.
I think the account is cut. Can we
Yeah,
focus on the doctor's account?
this one.
Okay, thank you.
Okay.
Okay.
Can we start? Can we start?
Still time, still 1 minute.
Oh, okay.
Okay, one thing about gastroenteritis is viral
Mhm.
because he said that only gastrolyte
But,
for medication.
I didn't understand. What did you say?
He said that
Mm-hmm.
inappropriate only
Mm-hmm.
medication gastrolyte. So it is viral, no need for antibiotic or to do stool analysis.
I think they said nothing about this type of gastroenteritis. Just
It
gastroenteritis.
just, yeah, it's okay. We don't have to explain. They just want to hear how you speak English. Actually, you can say anything, but make sure you very confidently whatever you say.
Time out. Start 5 minutes.
Yeah. Okay, let's start.
Okay.
Okay.
3, 2, 1.
Good afternoon. I am Dr. Ahmed Ali, the attending physician today. May I confirm your name?
Hello, Dr. Ahmed. I am Asha Rana.
How can I address you?
You can call me Asha.
Okay, Asha. How can I help you today?
Well, doctor, you see, I have this, my baby is 10-month-old and he's been having diarrhea and like, I don't know what he's suffering from. And I'm so worried because he's in this, like, in last 24 hours, he's gone to like, I've taken him to toilet or he's been having diarrhea for almost like 10 times and also vomited twice. And he's like urinating so much and is crying more than usual, and also I don't know what's wrong with him.
Oh, I am really sorry to hear this. Could I ask you some more questions about this condition?
Yes, of course, doctor.
When did this start?
I mentioned that it started just like last 24 hours.
Okay. Is it increasing or decreasing?
It's increasing, and he's like, I think he has a fever also, and he's coughing also, and he has soreness in his nappy area because he's been like poo-pooing for so many times.
Okay, I am really sorry to hear this. About his motion, is it soft or hard?
Yeah, it's liquidy. It's like like watery type, doctor.
Is there any blood with it?
No, there is no blood at all. I'm just worried he's becoming dehydrated. Is like, what should I do? Like, is there any medicine you can give him? Because I think he's like, he has done diarrhea so many times. I think he's dehydrated.
Okay, don't worry. I will assist him and do my best to help him. Could I examine him?
Yeah, sure. Go ahead.
Okay. Okay, based on your history and the examination of your child, he has what is called gastroenteritis. Have you heard about it?
No, what is gastroenteritis, doctor?
Okay, this is a condition where there is infection of his bowel. So, as a reaction to the microbe in his bowel,
What do you mean by? Is that tummy, doctor? Bowel means tummy?
Yes, his tummy. Yes.
Oh, okay.
So, as a reaction for this microbe, he had the speed of going to toilet is more frequent. due to increased secretion by the food pipe in his tummy.
What do you mean by?
Am I clear so far?
You mean food? You mean microbe means bug? It's like
actually,
a bug inside.
It may be viral because viral infection. Usually in this age it is rotavirus. Okay, but I can reassure you, don't worry, because your child is not dehydrated, as he passes urine frequently, and from my examination his eyes not sunken. So it is simple condition. It will resolve spontaneously. Just what we need to increase oral fluid intake and to take this medication, Gastrolite. I will give you.
So what should I feed him aside from the medicine, doctor?
You should continue breastfeeding more frequently. He may refuse initially, but after a while his condition will improve and he will come back to his normal diet habit. Am I clear so far?
Yes. So you mean to say that he will be all right after giving your medicine?
Yes, this is a simple condition, and it will resolve spontaneously. And I will give you another appointment after 1 week to follow up him.
Okay.
Is it okay
doctor.
with you?
Yes, doctor. So you mean to say that nothing serious aside from gastroenteritis, he doesn't have anything serious, is it?
Yes, it is not serious at all. And let us summarize what we have said. Your child has what is called gastroenteritis. This is due to infection of his tummy, food pipe in his tummy. This is a simple condition and will resolve spontaneously, and you will stick to breastfeeding and the medication I prescribed for you.
Okay,
is it okay with you, Asha?
Yes, doctor. Thank you very much for helping me.
Thank you. Thank you. Please, if you have any other queries, don't hesitate to contact me.
Okay, thank you.
Okay.
What's the time?
Well, it's 60 minutes now.
6 minutes?
1 minute more. Yeah, I tell time out.
Oh, okay. It's okay. I think because we were able to summarize, so I think it was within the 5 minutes because we talked.
Time was good. He finished at 5 minutes.
So because he was able to go to the dot, like 1, 2, 3, 4, 5, and summarize it well. But we cannot use. I've noticed in all of that one, most like Dr. Nam, Dr. Ahmed, and Dr. Mustafa, you cannot pause like for long. You have to check that habit. Okay, all of you, like you cannot say like, you know, if you say that you are you try to just what I advise you, just look at those what it's given there, like it says ask for more details about the child's symptoms. You keep on don't try to stop yourself like that. You just say, so what happened to the child? You said it has been for last 24 hours. Okay, has he vomited? How many times? You said. Okay, just anything. So is there any anything else unusual you see? Okay, so don't worry. You just have gastro. So Dr. Ahmed, how about you become the patient? I mean, you become the parent and I become the candidate. So what I'll do is I'll just go through that one because I don't know anything in detail. For example, I don't know anything about, but I'm going through the task. How will it look? Okay, let's see that.
Okay, 5 minutes start.
Okay. Yes, I'm Dr. Asha Rana. I'm the attending physician here. Sorry. Good morning. I'm Dr. Asha Rana. I'm the attending physician. May I have your name, please?
Good morning, Dr. Asha. I am Ahmed Ali.
How may I address you?
Ahmed.
Okay, Mr. Ahmed, what can I do for you today?
Well, my baby has frequent motion and he has vomited twice.
Mm-hmm. Okay, I'm so sorry to hear that. May I know when did it start? How long he's been like having motion for how many times?
Okay, this started 24 hours ago,
Mm-hmm.
and he has more than 9 times motions, and he vomited twice.
Oh, okay. And how about his urination? Is he going doing the wee regularly, urinating regularly?
Yes, he is urinating regularly.
How about his fever? Does he have a cough or anything?
He has fever, but
Oh,
no cough.
okay. So are you worried about so what worries you most about your child, Mr. Ahmed?
I'm worried that he may become dehydrated, and I know this
Oh, okay.
may be serious.
I understand your
Could
concern,
you
Mr.
help me?
Ahmed.
What is going on?
Yes, of course, Mr. Ahmed. I understand your concern. Well, first of all, let me explain to you. This is from what you have explained to me. This is what we call gastroenteritis. You see, there is something not normal, or there is a bug, or it can also be a viral infection in your baby's tummy, right?
What do you
And
mean, doctor, by gastroenteritis? Could you
well,
explain more for me?
yes, of course, Mr. Ahmed. Well, if there is an infection in your baby's tummy inside, then you can see such type of symptoms like um, like he's urinating more, or basically he is doing having diarrhea for more than 5 6 times. So there is an infection in the bowel. Bowel means tummy, okay? And you can see that
Okay.
what you have explained to me and what you have told me, that from what I've gathered is he's having this gastroenteritis. But I can assure you that we can treat him, and he's in very good hands as well. And I understand you have a concern of him having being dehydrated, but since he's urinating, and I think he's quite fine, and you do not need to worry about that. And for the infection, what we can do is that we can give him this medicine called Gastrolite, and it was more like equivalent to a saline solution or the water, because you're worried that he may be dehydrating because he's losing so much water from his body. So we will give him Gastrolite. Any
Mm.
like we can give
Okay.
and we cannot give any other medicine than gastrolite. So the other thing is that you once we've given medicine, then all these symptoms can be subsided or it will decrease, so you do not have to worry. Is that understandable, Mr. Ahmed?
Yes, it's clear, doctor. Uh, but what about his feeding? How can I
Yes, feed the baby. Yes, I understand, Mr.
feed the
Ahmed.
baby? Mm.
Yes, that's
He's
very
still
good.
breastfeeding.
Yes, understand. Well, what we have to do is we have to, that's a very good question. And we have to give him a suitable food, and we cannot stop his breastfeeding. We can continue it, and we have to compensate the water he has lost from his body as well. So he may not like to eat it at first, but you have to make sure that you feed him regularly and continuously. And you have to give him suitable food, not something very hard. Is that all right? Is that understood?
Yes, clear, doctor.
Okay,
Okay.
we'll go what we've just told you. Like you told me that your baby had some like diarrhea for more than 5 8 times. So, and also he's having this urination frequently, and you were worried about his dehydration, but luckily I think he have what that can be worked out with a medication called gastrolite, and he has what we call gastroenteritis. And as I've explained to you, after the medication, all these symptoms will be subsided, and you have to continue giving him the breastfeeding, continue with his breastfeeding, and also continue with him the suitable food, nothing very hard to upset his stomach. Is that all right, Mr. Ahmed?
Yes, yes, doctor. You made it very clear. Thank you very much.
If you have any more questions, you're free to come here, and I'm always here to help you. That will be all for today.
Okay, thank you.
Okay. So what I was doing was, I don't know anything about I don't know about the gastrolite or those things. I was just reading from what was given, right? And I was making it big and small only. I'm not going outside the task. I'm just sticking to the tasks I was given. And I asked one by one slowly. So what happened to the child? I asked him more. And then, so this is this second, he says, confirm the diagnosis. So I confirm. So this is called gastroenteritis. In the third, it says, give advice and reassure the parents. So I'm giving advice. The fourth, explain the inappropriate. So I say, I can only give you a gastrolite. I can't give you another thing. And the last, you say, you have to continue with the breastfeeding, and he may not like it, but you have to continue. So I complete this one, and I summarize it, and I say, if you have any question, come to me. That's all. Do you understand?
Okay. Okay. Yes.
So you don't even have to memorize everything. You don't have to think like, what am I gonna say if he asks me about this? I don't know. Just make it up. Just slowly. If you know everything, that's good. You can add. If you don't know anything about it, just stick to the task and just say it nicely and slowly. Simply.
Okay.
Any question so far? By anyone?
Okay. Great session today, and
Yeah, I think we're done. And anyone wants to? I think we are all tomorrow. No, day after tomorrow. I think that will be on Monday, right? Is it?
yes.
Okay, we'll see you on Monday, all of you. Or you want?
Yes, October 5th. Okay.
October 5th, 5 to 5:15 p.m. within that time.
Okay.
Oh, who will be? You'll be on call. So what time, Dr. Dr. Niam?
We
What
can
time
pause
you are?
the record. We can pause the record or stop recording.